Hey, Dr. C here with you. So is Tirosint better than Levothyroxine? This is a super important question. Most people who are on thyroid medication aren't yet feeling their best. And they're trying to figure out if they need different amounts, if they're on the wrong medicine altogether, and maybe you've heard about Tirosint as a different option. So this video will help you understand what the differences are between the medications, when Tirosint might be better, when might it not matter, and I'll briefly touch too on whether medications are even necessary. So that's the main point about this. First thought is about that last thing I mentioned, if medications are necessary or not. Simple thing, if you lack a thyroid, if your thyroid was taken out, you had a total thyroidectomy, the meds are necessary. Pretty straightforward, probably not a surprise. If you're on medication and you're pregnant or nursing, it's not a time to change. So whether you need them or not, it's more effective and safer to stay on them. But many people on medication may not need them anymore. Maybe their original diagnosis was one in which they weren't necessary going into it. Maybe their bodies have changed in some way to which now they no longer need it. But that's an important question. And something that's often surprising is that if you're on medicine that you don't need, you can not feel well. And sometimes you can feel like you're lacking in thyroid hormone, like you're getting too much, or even a mixture of symptoms. And that can occur wherever your blood levels are. Even if your blood level is fine, but if you're on medicine you don't need, you might not feel right. So please bear that in mind. I've had a lot of other videos on de-prescribing thyroid meds when they're needed. Consider looking at some of those as well. So for starters, let me compare and talk a bit about what Tirosint is. So this is a purified form of the body's main thyroid hormone, T4. The thyroid gland releases T4, a little bit of T3, and these hormones control a lot in your body. They control how fast we generate energy, how well we repair connective tissues, how well nerve signals move throughout the body, and they also affect how other hormones work that aren't even thyroid in nature. The T4, the 4 is the number of iodine atoms. Iodine's important. I'm not going to focus on it in this video. So T4 has 4, T3 has 3. Now, your gland mostly makes T4, and then your body converts some of that into T3. T4 and T3 are both important. T4 is called a prohormone. It exists to make T3, but it also does things all by itself. And Tirosint is a brand of medicine that contains T4. And it's only T4, it's not T3. There's other hormones too, I won't go into, but yeah, Tirosint is just T4. In that sense, it's the same active ingredient as Levothyroxine, Synthroid, Unithroid, Levoxyl. They all contain T4. The biggest singular difference between Tirosint and other brands is just that there's fewer inactive ingredients, and I'll talk a lot more about that. So how does this fit in the landscape of thyroid medication? Well, you've got T4 only medication. Those are by far the most widely used. Then you've got natural desiccated thyroid. This is often called NDT, like Nancy Delta Thomas for short. Also DTE, desiccated thyroid extract. Weird thing about medicine is that we've got to have multiple names and acronyms for things. It's not enough just to have one name because then you wouldn't have enough people confused. So yeah, we call this NDT, desiccated thyroid extract. Also call it natural thyroid. In some cases, one of the more common brands is used as a placeholder. So Armour Thyroid, for example. And yeah, this is desiccated freeze-dried pig thyroid. Now, funny thing, we call this natural, and we call T4 medications synthetic. Well, yes and no. So the T4 medicines are synthesized, they're made in a laboratory, but they're chemically identical to what the body makes. So how do you define natural? Do you define it as being, just taken from a natural existing source, or by its molecular shape? In the case of hormone replacement, we talk about molecular shape as the guideline to determine what's natural or not. But that doesn't really apply to thyroid meds, so we use different standards there. Anyway, so yeah, natural desiccated thyroid, so that's brands like Armour, NP Thyroid, and Adthyza are the 3 that are currently on the market. Then there's T3 only medication. The one brand here is Cytomel or Levothyroxine. And then we also have other things. So there are compounds that can be made to order, and these are called compounded thyroid medications. These are of those categories, but they're made up by a compounding pharmacy rather than pre-made by a manufacturing plant. So the advantage of compounded medicines is that they can be different dosages that may not be pre-made. They could have different inactive ingredients. The drawback is they may not be as well standardized, but there are compounded versions of T4, T3, combinations of T4 and T3, and there's also compounded forms of natural desiccated thyroid, so those all exist. Kind of as a last weird wrinkle, there's non-prescription thyroid glandulars. So prescription desiccated thyroid is generally from pigs, we call that porcine. The non-prescription ones are generally from cows, we call that bovine. They have active hormones, they're really not standardized, so that's the big difference about them. So yeah, the big differentiator about Tirosint, this is one of the T4 only medications, is the lower list of inactive ingredients. So Tirosint comes in capsules, gel caps, and also a solution. The gel caps, you've got the T4, you've got water, you've got glycerol and gelatin. That's the end of the list. Now, if I were to read the list of inactive ingredients in, say, levothyroxine, we'd be here a little while. There's a lot of inactive ingredients. And for most people, they're not a big deal. They're things that your body can digest, but not everyone is most people. You know, some have a harder time with the inactive ingredients than others. So Tirosint also has a solution. So the gel caps are just little gel caps, like a little fish oil or a vitamin E capsule looking sort of thing. The solution is kind of like a little creamer cup almost, or like a coffee pod. They look something like that. So each little cup is a dose. You pop open that cup and drink it down, and that's the dose for that day. That one is just the T4, water, and glycerol. So why is this important? Well, the biggest thing is just better absorption. You know, some people are taking medication, but they don't feel well. Their levels aren't stable, they're still symptomatic, and their scores aren't steady. Maybe they're up and down. Maybe their T4 to T3 levels aren't great. So it can be a big thing about there being poor absorption. In fact, many, when they switch from levothyroxine to Tirosint, they have to take lower doses. And that's simply because it's better absorbed, they may not need as much. And why is this better? Well, also in terms of the absorption, there can be a lower risk of allergic reactions. There are those who can react badly to the inactive ingredients. There's also more stability in dosing. You know, what's there and what gets in the bloodstream is more consistent from batch to batch. Therefore, you've got more bioavailability and fewer ups and downs. Some other big wins is that meal timing is less of an issue. So regular thyroid hormones, they've got to be taken at least an hour before meals. For some people, that's not enough. Some need longer periods of time. And there are those to where coffee can interfere with absorption. Some need their medication 4 or 10 hours after coffee, and that makes it tricky. That's rarely an issue with Tirosint. And there's also those who require antacid therapy. They take proton pump inhibitors longer term. That's a big problem with many thyroid medications, but also less of an issue with Tirosint. So yeah, those are some differences. Some other ones are that there's a pretty big range of potencies. There's actually 15 different potencies. And Tirosint is unique in that it has a very low potency, 13 microgram. Most medicines have nothing that low. Few need that little, but it's nice because that can be used along with other potencies to do more fine tuning. So yeah, Tirosint comes in a wider range of potencies and a lot of in-between ones, things like 44 micrograms, 62.5 micrograms, 112, 137. These are ones that are not found in most other brands. How do you use this? Well, this is taken orally once daily. T4 has a very slow metabolism. It's got a half-life of many, many days. So taken once daily, you get steady, even levels, no big ups and downs. In fact, the metabolism is so slow that some can even take different amounts on different days of the week and do pretty well with that. Some even do once weekly dosing, believe it or not, and that's actually quite effective. So who would this be important for? You know, those that have some gastrointestinal issues, things like SIBO, acid reflux, IBS, inflammatory bowel disease, those who have had gastric bypass or other gastric surgeries, they can often have a hard time absorbing. Then we think about those who have shown an intolerance to more common medications like levothyroxine or Levoxyl, or maybe they've reacted badly to some of those inactive ingredients. Next, we think about those who need acid blocking therapies. They take proton pump inhibitors, those again who have had bariatric surgeries. And then we think about those who have multiple food allergies or a lot of food sensitivities. Then there's people that have gastroparesis or slow intestinal motility. Then there are those with intestinal permeability. Then there's those who have tried other medications like NDT or those with T3 and do not do well with those. And there are those who react badly to medications even in tiny amounts. And then there's those who've done a little better on levothyroxine or Synthroid, but not totally all the way. And then we think about those to where their schedule just makes it really hard to, have to take things on an empty stomach a long ways away from other foods. So what are side effects and risks? Most of the side effects and risks are related to how appropriate the medication is and how appropriate the dosage is. If someone doesn't need it and the dose is appropriate, risks are pretty minimal. No big ones there. There is a thought about whether Tirosint can cause weight gain. And this is true for T4 only medications in general. And it's not so much that the medicine causes it, it's more so that if someone doesn't need it. If it's not needed and someone takes it, it can inhibit their body's ability to make and use other thyroid hormones. So that's a big thought. Someone who's breastfeeding or pregnant, if they need the medication, they need to stay on that. They may need more frequent testing and more gentle dose adjustments. So what can be used instead of Tirosint? Well, we mentioned other brands of T4 like levothyroxine or Synthroid. There's also then the natural thyroid. And there's those who do better on natural thyroid. That definitely happens, all things equal. And those who do worse on natural thyroid. So a little bit of it is trial and error. And it's not even perfectly predicted based upon blood tests or T3 levels. It's often more a matter of just a personal response. There are protocols that use T3 only medication like Cytomel by itself. Those are not recommended because that's just not a natural state for the body. If those are taken in high enough amounts to work, they actually block the body from using T4 and from making T4. And T4 is more than just a way to get T3. So a really common scenario is people might be on a T4 medicine like Tirosint and then combine that with other medications. It's totally common and totally acceptable. That could be Tirosint plus natural thyroid or Tirosint plus some Cytomel. So altogether, Tirosint is a medicine that's very welcome. There's a lot of folks who need therapy but can't absorb common medications well. So it's great to have one more option. And I've seen many to where when they change over, they do a lot better. Their symptoms improve, their blood levels are more stable. They don't have to be exacting about their timing. So this has been a big win and a real godsend. A consideration is that there can be cost differences. So some insurance plans cover it better than others, but there are ways by which the manufacturer does offer coupons, saving plans, direct order options, so there can usually be workarounds. But altogether, Tirosint's a great option. If you're on levothyroxine and not doing well, it's one of many things to consider. All right, Dr. C with you. Take great care. Bye-bye.